Hi, my name is Damon Henry and I'm an extended scope practitioner in spines. Welcome to this video about a type of operation called a scoliosis correction for degenerative scoliosis. We hope you find the information in this video informative and helpful about your upcoming surgery. Spinal operations are performed for spinal problems where normal conservative management has failed to help your symptoms, or there is a risk that problems may worsen if not addressed. This video is about scoliosis correction for people with degenerative changes within the spine that cause the spine to curve out of its normal shape or alignment. This process has normally occurred very slowly over many years. With time, the curve can sometimes make it hard to stand up or walk. Sometimes there can be pain around the site of the curve, or it may contribute to the compression of some of the nerves in your spine, which may also give you limb pain. This video is about scoliosis correction. This is an operation where a surgeon inserts metalwork in your spine to help correct a spinal curve or prevent a spinal curve from worsening. This may lead to further problems if not addressed. A scoliosis correction will create a significant stiffening of your spine between the top and bottom bit of the section that is fused. Scoliosis correction surgery is usually performed from the back of the spine by inserting screws and connecting rods into the bone. This may only be a few sections or segments of the spinal column, or it may involve a large number of segments from the bottom to the top of your spine. You will have a scar over the corresponding areas. Sometimes the surgeon may also need to add some support from the front of your spine by adding some cages between the vertebrae. If this type of surgery is performed, then you may have a scar on the front or side of your abdomen. If you're having a scoliosis correction, then you are likely to have more restrictions of your movement and loading after the surgery to protect the spine and allow the bone to fully heal, creating a more secure fusion. It is important for spinal surgery that you have stopped smoking before your operation to allow better healing and to reduce the risks of complications. If you think this may be difficult for you, then you must discuss this with your surgeon and usual GP, where help should be available. Your surgeon may also speak to you about weight loss before your surgery. There may be a weight target that you need to achieve before your surgery can be safely performed, which your surgeon will outline to you. There are a number of other medical issues that your surgeon may want addressed or optimized before operating on your spine. These include diabetic control and managing the risk of osteoporotic fracture, as these may increase the risk of complications. Sometimes medication needs to stabilize these problems before you can have an operation. It is important to try to get yourself into the best position you can before your operation with regards to fitness and conditioning. We understand that this may be difficult when you're in pain, but with advice from the team beforehand and using strategies to help you, it is still possible to optimize this before your operation. Being a bit fitter before your operation reduces some of the risks associated with having an anesthetic. Try to walk a few times per day, even if it is not very far. Any exercise that increases your heart rate and breathing will be helpful. If walking is too painful, then other exercise, for example walking in a pool or using an exercise bike or rower, may be helpful. Whilst these exercises may seem scary, many people find them more comfortable than walking once they start. Speak to the team performing your surgery if you have any concerns about cardiovascular fitness ideas. Many patients find that recovering after surgery is a bit easier and quicker if they have done a bit more before surgery. It is often helpful to try to build some muscle up before surgery, particularly the strength of the legs. After your surgery, your back will be sore and feel stiff even if you haven't had any fusion surgery performed. Being able to get in and out of a bed and chairs will be easier if your legs are stronger. This will make getting home easier and hopefully quicker. There are videos on the website demonstrating some simple exercises you can try at home whilst waiting for your surgery. For some people, practicing your balance is also helpful before surgery, particularly if your balance has worsened prior to your operation. This may reduce the risk of falls, which can cause injury and prolong your stay in hospital. If you have further specific questions about what you should and shouldn't do before your surgery, then please discuss this with your surgical team. There are always risks when an operation is performed on someone, and these risks vary from person to person, but no surgery is entirely risk-free. This list of complications is not exhaustive, and the risks and complications specific to you will be discussed at your consent and preoperative appointments. Bleeding during or after surgery can result in excessive blood loss, and occasionally this can require transfusion, and sometimes you may need to go back for more surgery if the bleeding causes compression on nervous tissue. Blood clots may also occur in the lungs or deeper limb veins. If not treated, then this could be fatal. You can reduce your risk of this occurring by getting up as soon as is safe after surgery, doing your exercise on the wards and at home, and keeping hydrated. You may also need to stop the contraceptive pill if asked. Movement of the implant can also occur after surgery. Infection is another complication that can occur after surgery. Infection of the superficial wound can usually be treated with antibiotics. A deep infection can be difficult to treat and sometimes requires further surgery. The risks of this occurring are higher in people with other health problems, particularly if your immune system is suppressed. Nerve damage can occur, and this may not be reversible. This can result in permanent loss of function in that affected nerve. Many of these factors can be improved by improving your health before an operation as much as possible, and by making sure that your medical problems are stable, and by keeping the surgical team completely up to date with any changes in your health prior to your operation. Spinal surgery might not always predictably resolve pain, particularly back pain. Pain in the limb is usually helped by spinal surgery if the nerve is successfully decompressed. It is important that you have an honest and open discussion with your surgical team about the expectations you have after your surgery. Unfortunately, some people continue to get the same or occasionally worse pain following surgery.